Welcome to the channel Dentistry MDS Preparation. So this is our second lecture and we are going to study about dental radiography. So look at this symbol first. This is having a yellow background and there is a symbol in between which is black in color. This can be in magenta also. So this symbol is known as trefoil and it denotes the radiation hazard. Okay. Then we have various film sizes. Various film sizes are used for different radiographic techniques. So we have 0, 1, 2, 3, and 4. 0 is usually used for children for biting as well as the intraoral periapical radiograph. 1 and 3 are rarely used and film number 2 is used for mixed dentition as well as in adults for biting and the intraoral periapical radiograph. Now there is a film number 4 which is an occlusal film which is used to take the occlusion view of both the maxillary and the mandibular teeth. Okay. And there has been a question asked previously, what is cracker, bite or cookie? So we have discussed that occlusal film, for occlusal film, film size number 4 is used. But if the size number 2 film is used for an occlusal radiograph in a pedo patient, we call it a cracker, bite or a cookie. Okay. Now comes the film speed. Firstly, remember in pedo patients, what is the fastest speed film and which is the largest film which can be used in the patient which he can tolerate, that only can be used. Okay. So for caries detection, most commonly the film speed E is used and the most recommended one or the best one for the caries detection is film speed F. Next, for the incipient caries detection, the film speed D is used. Okay, for caries detection, most commonly used is speed E. Most commonly and the most recommended, the best one is speed F. Then for incipient caries detection, if this is specifically asked, then we write speed D. Now, what is the angle for different tooth? The radiographic projection angle we are going to now read. Okay. So for maxillary teeth, we are going to keep the tube tilted towards downwards. So there is a plus sign over there. For mandibular teeth, it is tilted towards upwards. So there is a negative sign. So for the molars, for maxillary teeth, plus 20-degree angulation is there. For premolars, plus 30-degree. For canines, plus 45-degree. And for anteriors, plus 40-degree angulation is there. For mandibular teeth, it is minus 5-degree for molars, minus 10-degree for premolars, minus 20-degree for canines, and minus 15-degree for anterior teeth, which is the central incisors and the lateral incisors. Okay, you just need to remember these angulations. And then a few questions have been asked earlier. What is the enamel thickness in the primary teeth? It is 1 mm uniform thickness in the primary teeth of enamel. And in permanent teeth, it varies between 2 to 3 millimeter. Okay. And the permanent tooth which has the thickest enamel is third molar. Remember this. Okay. Then there is a film series or film survey like 4 film survey, 8 film survey, 12 film survey and 16 film survey. You must have come across these questions. So what all films are included? What all radiographs are taken in these surveys? If they ask for a 4 film survey, then in that 2 bite wing and 2 anterior occlusal radiographs are taken. Okay, 2 bite wing and 2 anterior occlusion. Then the 8 film survey, same as 4 film survey, 2 bite wing and 2 anterior occlusal will be taken, plus 4 right and left, upper and lower posterior radiographs are taken. These 4 are added. Then in 12 film survey, above 8, that is the 2 bite wing, 2 anterior occlusion, and the 4 right and left, upper and lower posterior radiographs, plus 4 canine radiographs are taken. Then in 16 film survey, all the above 12 plus 4 posterior permanent molars, these radiographs are taken. Okay, remember these. This is a very important question which is usually asked. Then few important points related to the ages. Okay, a child who is aged 2 years of age, he suffers. He is having a separation anxiety from mainly the mother. So this age is considered the terrible two, which is the pre-cooperative stage. So the child cannot be he's very anxious if we try to separate the mother from the child, and he becomes he's very difficult to cooperate during the treatment. Then the less than 3 years, the film which is used for taking the radiograph, it should be preferably held by the parent, mainly the mother. Okay, because at this age the child lacks cooperative ability. Okay, so these were few important points regarding the dental radiography in pediatric dentistry.